Hey Instagram, it's Dr. Rick, and today's unboxing is on omega-3 oil. Now, whether you're vegan, plant-based, or carnivore, paleo, keto, it doesn't matter. Across the world, different cultures have different flavors and different textures and different ratios of macronutrients, carbohydrates, fats, and proteins. But the Mediterranean has been shown to be, across the board, the healthiest, I guess you could say. And there's not just one form of healthy because there's so many variables, but one of the components of the Mediterranean diet is high omega-3. You'll hear about omega-3, you'll hear about fish oil, you'll hear about plant-based oil, and I think it's an important variable to consider fixing if you have a standard American diet, standard American lifestyle, and standard American problems. So usually those little hits that accumulate over time as far as risk are weight, inactivity, elevated cholesterol, high blood pressure, and then diabetes or insulin resistance. All that stuff at low level is about just the same as having a heart attack. So whether you have a heart attack suddenly and then you have to change life, or whether you have all those components that lead to a heart attack eventually, it's important to modify any variables that lead you down the wrong path. And I think something as easy as omega-3 will be a supplement to getting you to a healthy lifestyle, in addition to changing all those other risk factors. So this is not meant to get you to be plant-based, and I know that rubs people the wrong way. This is Greger's book, How Not to Die, and he's purely plant-based. Full disclosure is I'm a plant-based athlete, but I entertained a thought experiment by going full carnivore for 4 months. And I'll do another video to follow up on and show you what happened to my cholesterol. A little bit surprising, and a little bit expected. But bottom line is that I'm able to reverse that, and I'm going back to being plant-based. For those of you who aren't interested in that just yet, that's okay. I mean, eventually, I think nutrition should support exercise. I think exercise should be every day. I think daily exercise and nutrition give you a better sleep, and it keeps youth. Youth doesn't just mean full of energy and able to eat anything. It means that you're pushing back disease. Ultimately, that's what we want to do. Going back to what I just discussed with you before, we want to push back the heart attack and the stroke and the cancer. I think it's important to understand an integrative approach to reducing risk factors. And one of them, again, goes back to omega-3. So the bottom line with omega-3 and omega-6, or all fatty acids, is that we have that as part of the macronutrients I discussed earlier, fats, proteins, and carbohydrates. If you have too many omega-6s, that's considered pro-inflammatory. If you have a lot of omega-3s, that's considered anti-inflammatory. So if you had a choice between pro and anti, I would pick anti-inflammatory. And there's a way to coax the body into thinking anti-inflammatory most of the time, especially when it utilizes those omega-3s. We do have to utilize omega-3s for basic processes that the body goes through. So while you're working on dialing in your diet, I don't think it will hurt to take a supplement or two. And a lot of my patients, they do take a lot of supplements, but they're also working on diet, building up exercise, and a couple other things. I think this is a shortcut until you get to the point where you're a really fantastic culinary expert, athlete that's exercising at the age of 60. So as a surprise, there are 2 labs, LabCorp and Quest, that offer omega-3 testing. With LabCorp, they have something called an omega check. And this is one patient's, I blocked out everything, but this is an omega check that shows you about if your omega-3 level is decent enough or your omega-6 level is too high. You want omega-3 high, omega-6 low. Here, the omega-3 level is low and there's high risk that's pointed out. For those of you who like data, they actually break down the omegas that are present in the body. So you can see with omega-6 being high and cholesterol being elevated, you're asking for a bad combination. When cholesterol is elevated and you're in a pro-inflammatory state, sometimes that guarantees you're going to have elevated cholesterols deposit on your coronary arteries. And I'll be doing a video follow-up for that, but it is important that you decrease that. A little bit of cholesterol deposition and oxidation over the long haul, 10, 20, 30 years, again, you're winding up with a heart attack. And we can fix you with a stent, but at that point in time, you have steel in your chest. And if you don't change your bad ways, usually it ends up with a bypass a couple, 10 years down the line. I happen to like the way Quest puts their color chart out. It's just easier to read. I mean, I can interpret both LabCorp and Quest. I don't think that you'll be able to get this with your average doctor. You have to ask for it. And it might not be paid for because some insurances consider it experimental. But I think it's worth trying, especially if you're undecided. Is this fish oil that you're taking good enough? Do I need to switch from plant-based oil to fish? Do I even need any DHA or EPA? In this patient, you see that there's low risk. So this patient's doing good with regards to the diet and plus or minus if they're taking omega-3. This patient has a moderate risk. So in her, especially if there's an elevated cholesterol, I would add more omega-3, whether it's plant or fish, doesn't matter. I just add more omega-3. And omega-3 is a combination of DHA and EPA. I'll put a link down below to further explanation. And it's just kind of nice with Quest because they also offer a couple different whole food choices to increase your omega-3 levels. Finally, this is what happens when you don't take enough omega-3. You're overwhelming the system with omega-6s. You're high risk. Sorry, this is black and white, but this is the same definition or suggestions as far as the type of foods to eat. But while you dial that in, I think it'd be important to consider using supplement because it gets you there faster. If you want to reduce the risks fast, supplement is the way to go. This is Nordic Naturals DHA, and this is one of the omega-3s. This is more for plant-based folks. So if I have a patient that's pregnant, I would suggest that we increase the amount of DHA because it helps in forming the baby's organs, the neurological system, neurotransmitters early on in pregnancy. This is just more of a prenatal probiotic, but a lot of prenatal vitamins will include DHA, in addition to choline and iodine and selenium and a couple other things. But if you're plant-based and you're worried about getting fish or mercury in, this is the way to go, algae-based. And the other positive with this is that because it is algae-based, it doesn't have the smelly fish oil or odor that you get with fish oil. This is Viva brand, and it is cheap. I've researched their data online. Pretty decent company, not so expensive, and it's about 1,000 milligrams per capsule of total omega-3. And of all the brands I've seen out there, the concentration of total omega-3, that's DHA, EPA, in each capsule is highest for the cheapest price. And I really think that at this point, when you go through the distillation process of killing the fish, melting the fish, high pressure temperature, and extracting the oil, I believe that you should be okay with the majority of fish oils that are out there. Again, the quality of fish oil, the amount of milligrams per capsule are important. A lot of the other cheaper brands will have 340 to maybe 500 milligrams per capsule. And if you're trying to maximize on your total omega-3 intake, the body can only take about 2,000 at a time. So I usually suggest 2,000 milligrams of total omega-3 in the morning, 2,000 milligrams of total omega-3 at night. And that's probably about all they can tolerate. Now, there's data that shows increasing even past that, like 2 more in the afternoon, can actually lower blood pressure, but it's just a big pill to swallow, and it is expensive after a while, and people kind of have problems with odor and burping. My little trick is that if you take the bottle, empty it in a Ziploc bag, keep the bottle next to your other bottles where you can see them in the morning, and then just stick the Ziploc bag with the capsules in the freezer, it'll decrease the burping. And it's a pretty decent trick. I've been using that for 20 years, and it does work. If for those of you who have problems with odor or belching or reflux, putting this in the freezer, you'll probably forget it. So try to separate the two. But in plant-based practitioners, EPA is not really available. You can get ALA as a precursor if your body can convert it over to omega-3. Of the omega-3s, typically EPA, the stuff that you get from fish or that you might be able to digest and convert if you do ALA. EPA serves the joints, the skin, and a little bit of the brain, and the viscosity and suppleness of the blood vessels, thus to help with lowering blood pressure. DHA typically helps the mood and the brain develop. That's why we usually will have our pregnant patients take DHA. Again, this is a probiotic, not a multivitamin, but I didn't have a multivitamin to show. So a couple of multivitamins for prenatals will have a little bit of DHA. I don't think that there's any overdose on DHA, so sometimes it's important if your prenatal doesn't have it or your multivitamin doesn't have it, that you take a supplement. Again, supplements are meant to supplement diet, so you always have to keep on working on diet, but in the case where you're pregnant and you have 9 months to really do the best you can, I think it's important to just throw everything at the healthy pregnancy to decrease chances of neural tube defects. And ultimately, for those of you who have problems with depression, anxiety, joint pain, elevated cholesterol. Bottom line is that for those of you suffering from joint pain or arthritis, mood disorder like anxiety, depression, skin issues, cholesterol elevation, I think it's important to consider maximizing an omega-3. If you don't have any insurance to check your omega-3 levels, just go ahead and take as much as you can. But again, that's a shot in the dark. I think it's better fine-tuned when you do this functional medicine approach by checking levels. Keep on doing that until you reach a low risk level and you maintain that in addition to fixing your diet. It takes a while to find your groove as far as what type of diet, what type of exercise, how often to do it, what your budget is. But until that point in time when you and your lifestyle coach and your team get you to healthy living, I think this will be a nice way to extinguish other risk factors that are starting to develop. For those of you who would try that freezer trick and been successful, or you have a good brand or a stinky brand, put them in the comments down below. Otherwise, don't forget to subscribe to me, my YouTube channel, and hit the alert bell to find out when I do new videos. I'll see you next time. Stay healthy.